Hi guys, welcome back to another video. If you are new here, welcome. My name is Ami. I am a nurse practitioner. On this channel, I talk a little bit about nursing, mental health. I do hair tutorial. I talk about finances. And if these are topics that you're interested in, please subscribe and join the family. So today's video, I wanted to talk to you guys all about nurse practitioner, but specifically focused in family medicine. So I am a family nurse practitioner. I've been a nurse practitioner for about 2 years, a little over 2 years now, and I do have my doctorate in family practice. So today I wanted to kind of give you guys an overview of family nurse practitioner, just in case you're a nurse and you're thinking about, okay, what is it that I want to do as a nurse practitioner? Do you want to specialize in family medicine? Do you want to be a psychiatric nurse practitioner? Do you want to work with patients mostly in the ICU, which is acute care, or do you want to work with pediatrics? So I wanted to give you guys an overview of, as a family nurse practitioner, and the reason why I chose that route. So first of all, let's talk about schooling wise. So as most nurse practitioner program, regardless of the specialty, a lot of the time you're looking at a 2-year program. That is if you've already had your RN, BSN, so a registered nurse, bachelor's of science in nursing. So a lot of the time, if you already have that, for you to transition from that to a nurse practitioner, which is an advanced practice registered nurse, is usually would take you about 2 years. So that's for a master's program. For some doctorate program, it may take you up to 3 years. So depending on the programs, on average of 2 to 3 years if you're thinking about becoming a nurse practitioner. So for family medicine specifically, for me, since I went for my doctorate, it took about 3 years. So that's all year round, summer, spring, and fall. So it took me about 3 years to acquire my degree. And in terms of the reason why, schooling wise, depending on where schooling and tuition, depending on what state that you reside. So for example, when I was in Pennsylvania, for an undergrad degree, it cost me at least $35,000 to $40,000 a year. And now I live in North Dakota, so that's Fargo, North Dakota. That costs a lot less. So even for my doctorate degree, when I was going to school per year, it was roughly about $10,000 to $15,000. So that's a huge difference for a doctorate degree or schooling for you to be paying compared to undergrad. So that's ranges anywhere from like $4,000 to $5,000 a semester. So it's still expensive, but compared to like the East Coast, that's a lot of money, you know? So that's something that you want to pay attention to. Finances wise and tuition wise, it's going to vary based on where the state in which you reside. So that's a major thing. Again, for me, on average, for my doctorate program, it cost about overall $40,000 for the 3 years. So whereas some schools in different states may be a lot more expensive. So that's something to kind of look into. So one of the reasons why I decided to pursue a degree in family medicine is because for me, when I worked as a nurse, I like the option as a nurse being able to work in the ER. You can go work in OB, you can work with just pediatric, you can work in the nursing home, or you can work in the clinic. So you have so many options as a registered nurse. So as a nurse practitioner, I wanted to do something that gives me options to be able to work in different areas if I wanted to, and also the flexibility of working with different age groups. So for example, as a family nurse practitioner, you can work with patients across lifespan. So what I mean by that is that you can see anywhere from like a 1-month-old or a 2-week-old to anywhere from 100 years old, someone that's 100 years old. So that was pretty cool for me. It's like you really don't get bored because you get to work with different age group and you get to have a variety of knowledge about different things. Whereas if you go to school as a pediatric nurse practitioner, you can only work with pediatrics, which means anywhere from newborn to all the way up to less than 18 years of age, or sometimes 16, depending on where the state in which you work and also the specialty in which you work, if it's outpatient or inpatient. If you ended up going to school and do adult-gerontology, that one you usually will have to work with just adult population. You can't really see kids. So for me, that was a thing where I just wanted to be able to have that option to be able to work with all age groups. And you're also able to manage different disease processes where you're not just, for example, if you are a psychiatric mental health nurse practitioner, you can only work with individuals with mental health. You can only treat patients and their mental illness. Whereas as a family nurse practitioner, you do have the option to treat not only physical health, but also mental health. So basic, if you're just treating the minor basic anxiety, depression type of things, usually it's outside of your scope of practice. If you ended up doing things like managing patients' schizophrenia that are schizophrenic or bipolar disorder and more of the complex mental health issues. So as a family nurse practitioner, you're able to treat minor mental health issues, which is really nice because you do have a lot of patients that are not able to get into to see a psychiatrist or psychiatric mental health nurse practitioner right away. And you are the one as a family nurse practitioner that those patients are seeing most of the time. So you're able to start treatment for anxiety and depression. There are some family nurse practitioners that feels comfortable treating ADHD. So sometimes depending on your educational background, whether it's a nurse or when you're in your nursing NP training in terms of your clinicals. For me, I was able to do clinicals in other areas like the ER, where you're able to see patients with mental illness, or other specialty areas where sometimes you may follow a nurse practitioner that is specialized in both family medicine and psychiatric mental health. And if you're following that provider, a lot of the time you're exposed and you're able to see patients with more chronic or severe mental illness. So depending on your training as a family nurse practitioner, sometimes you're able to take care of a little bit more, but just knowing what your scope of practice is, which means that what you're able to do within your licensure. So that was the main thing for me is A, I get the opportunity to work with all age groups. B, I get the opportunity to work with both patients' mental illness, the basic mental illness, and also taking care of their physical health as well. So for me, it was a plus, honestly, because you pretty much don't get bored and you don't feel like you're stuck on doing one thing. Another thing also that's really good for if you want to become a family nurse practitioner is the fact that you are able to specialize. Let's say, for example, you want to just work with patients that have heart issues. So that would be cardiology. So you will work with a cardiologist and you're able to manage patients' high blood pressure, CHF or congestive heart failures and things of that nature. If you find it more interesting to work with just patients that have kidney issues, so that would be nephrology. So you have that ability to specialize in different things as a family nurse practitioner. So that way it's not just you working with just family medicine. So that's a lot of the pros of family medicine, honestly. And one of and if you decided, okay, I'm doing family medicine and there's a specific area that I really enjoy, you can always go back to school and say, for example, on my end, I really enjoy working with patients and their mental health issues. So I went back to school and I'm working on acquiring my certification for a psychiatric mental health nurse practitioner. So that gives you a little bit more option compared to sometimes if you just go for one of the specialties that's just strictly on one thing, again, with like the ones that I've mentioned, whether it's psychiatric mental health nurse practitioner, that's the only thing that you can see and that's the only thing you can work with. And sometimes that can be a positive thing for some people, but for others, it may be where you start doing it and you absolutely hate it. And then you have to go back to school and do something different and get a certification on something different. Whereas at family practice, if you get tired of working in family medicine, you can then specialize and say, I'm going to go do cardiology, I'm going to go do nephrology, I'm going to go specialize in endocrinology, and most of those things you don't usually have to go back to school for you to be able to do that. So that's one of the main things why I chose to be a family nurse practitioner. Right now I'm specifically focusing on just mental health, but I do have the option to treat someone's high blood pressure if need be, because some of the medications that we use in outpatients or for mental health can also affect your blood pressure, can also affect your blood sugars and things of that nature. So that's pretty much it in a nutshell. I hope this video is helpful. Comment down below, let me know if you have any questions about anything, whether it's nursing related, whether it's nurse practitioner related, and I'll be more than happy to answer those questions. Until next time, guys, stay positive, be kind to one another, and I'll see you on my next video. Bye, guys.